So rosacea is quite a complex condition. Lots of the people suffering from rosacea have had a really hard time dealing with it up until now. So if you have a consultation coming in for rosacea, have a talk with the client about what they've tried previously. They may have tried antibiotics. Some people have tried topical cortisone creams for flare-ups of acne, rosacea and things like that. So sort of get a sense of where they're at in terms of what they've done so far for the condition, and just provide a lot of reassurance that we see amazing results here with our rosacea treatments, a combination of products and treatments that we do for the condition. I usually at this stage get out one of our company headed notepads, because I'll write down a treatment schedule that I'd recommend, and also the products and the supportive regime that the client can commence at home to really optimise their outcome that they can achieve with us. Rosacea is different from just a normal vascular skin type. Rosacea is a condition of the skin. It's incredibly vascular. There's a lot of redness to the skin, and it's very, very reactive. It can be hot, sore. It can flare up in response to any triggers, like environmental triggers, sun exposure, any products, certain specific products, sensitivities to diet, digestive flora. It's all combined. So that's why rosacea is so complex. So I always tell clients that treating rosacea successfully, it's never going to be a cure, but we can manage the condition with them and get it to the point that it has far less of an impact on their life in general and their self-esteem. So treating rosacea is a combination of internal and external options. So internally, we now know it's clinically proven that digestive flora balance is directly related to rosacea. So that we need to get a good, healthy gut, and that will have direct ramifications on how extreme the condition is. So talk to the client about a clean, healthy diet, minimal alcohol intake and sugar intake, and also encourage them to commence on a probiotic. And also there's a lot of research now into fermented foods, which aren't so popular in our culture, but they certainly are overseas. So kimchi, kefir and kombucha, they're the three that I'm familiar with. So they're fermented foods and drinks. They're so good for digestive flora balance, and lots of my rosacea clients are now getting really into supporting their body through that kind of thing. So through fermenting their own or purchasing fermented foods and drinks and just making that part of their daily intake. Externally, they can support their skin with a product. The vitamin B super complex here in the ASAP range is really, really good for rosacea clients, because it's quite anti-inflammatory and it optimises skin barrier function. So it makes their rosacea a lot less reactive to environmental triggers. It's a lot less angry and likely to flare up if they've got a better skin barrier. Treatments-wise, we treat with a huge amount of success here. So rosacea is just a huge amount of vascularity in those upper layers of the skin. So it's those vessels are very, very close to the skin surface. They dilate and flush in response to any trigger or emotions, or moving from a hot to cold or cold to hot environment. So that client always feels like they're just constantly flushing. So all we need to do is target those vessels and hopefully shut them down, clear them and dampen them down, so the client has much less ability to flush so severely. So we use our Vascular IPL filter for clients with rosacea. Depending on the extent of the rosacea, we do start on cautious settings, because there is a lot of vascular target in that tissue, so it can really, really heat their skin up. So treat cautiously to start with. I always write down on their little headed notepad a vascular IPL treatment with the price next to it, depending on the area they're having treated. And then I always write expect 2 to 3 sessions, then maintenance as needed. 2 to 3 sessions 1 month apart, then maintenance as needed. If you write it down while you're speaking to the client, they seem to just really get on board with it and and accept the entire program ahead. It's not a quick fix. It's not a cure. And they don't just come in for one treatment and then the condition's gone. They need to sort of work with us and we'll tackle it together. The risks of the treatment that we do, the vascular RPL for rosacea, is just, as I said, that it's quite easy to overheat the skin because there's so much of the target vessels in that skin. So we just treat on cautious settings because we don't want to overheat and cause blistering. In theory, it could cause pigmentation changes or scarring if it didn't heal very well. The main risk would be blistering from overheating, and then that blister has obviously got to heal well for there to be no residual scarring. So we just treat cautiously. Aftercare from a treatment like that is to provide a bit of cooling while they're still here, so aloe vera gel and cold packs. Tell them to just have a quiet evening when they're home, and that they may well be quite puffy the next day because there can be a lot of swelling from that little bit of tissue trauma that we've caused. Because we're using the vascular RPL, we are coagulating and thermally damaging the blood inside those tiny little vessels. So we are collapsing and sticking all those little vessels to themselves, and the macrophages in the bloodstream come along and clear away those vessels that are now recognised as debris. So that client will have a little bit of tissue trauma in that they'll be a bit swollen for the next day or two, and just tell them to expect to have the full sort of month downtime in between treatments for those macrophages to come along and do their job. So the results aren't instantaneous either. Sun protection's a really big thing with any of our intense light therapies, including laser and IPL. Sun protection's the biggest responsibility that the client needs to accept for themselves, and we just need to rely on that. We check it every time they come in. So sun exposure, and just check that they're not on any blood thinning or photosensitizing medications, because that affects the safety of the treatment. And the blood, if they're on blood thinning medications, it can compromise the outcome that we may achieve.